we're seeing that. But my vaccinated patients do better. For the most part, they're not hospitalized. 9 out of 10 of my patients that are hospitalized, especially to the ICU, are unvaccinated. And I would say about 8 out of 10 of my patients that die right now are unvaccinated. So it's kind of staggering. So.
What's the latest CDC guidelines as far as the person tests positive? I'm here now 10 days with no negative. You can return to work 10 days with no negative result.
It is 10 days. So it was a while back that they went from 14 to 10, but not every local business did that at the time. We really don't recommend a follow-up test. If symptoms have reduced and you don't have fever anymore, and it's been over a day since fever, we don't recommend a follow-up test, because if I test positive today, I may test positive still for 3 months. So, but if you're still symptomatic, still have fever, then you are still contagious. We would not.
So the key is symptomatic.
It is. So like we allow, so employees at the hospital, for example, if they test positive for COVID, they're out for 10 days, they can come back on day 11. But it has to be no fever for over a day and your symptoms have to reduce. Now, sometimes people are going to keep a cough. I mean, let's be honest, COVID can damage you long term. I had COVID in November and I have asthma now. So, I mean, you're going to possibly keep some symptoms, but as long as it has a dramatic reduction, you're feeling somewhat better and you don't have fever.
So would you suggest that on that 11th day, before he comes back to work, to have a temperature checker?
You can do that. You can. For hours, we're allowing self-reporting of that. But you can. I mean, the temp check is not a bad idea. I'll be honest with you, though, just for me personally, we don't see a lot of people catching temps with those forehead checkers. I do think it prevents people from coming in who know they're sick. I do, like psychologically, I think, I know I'm sick, they're going to check me, I don't want to go in. But forehead checkers, I don't think we've caught hardly any with fevers on a forehead check. Symptom check, I think, has been somewhat more effective, or oral temperatures.
Well, how many people do you, and the statistics may tell that in Octavia County vaccinated?
Last time I looked, we were at about 38% of the county. I do think that's gone up, though. We've had a significant rush on vaccine in the last few weeks. So I've not seen new numbers, though, since then. I will say we went from giving hundreds a day to, okay, we might see 20 come in who want it. Some days it wasn't very many at all. And we're back up to hundreds. Yeah.
Well, I did hear briefly, Governor Tate, he said that this has become the pandemic of the unvaccinated. It's his words.
Yes, absolutely. We are still seeing infection women in the state that are dying from it, pregnant women. It's awful.
In lieu of what's going on, would the board consider using some of that pandemic money to pay people to get the shot in Octavia County? That's an allowable expense, where we can actually pay people to get the shot. But we don't have a 38% or 40%. What do we need to get herd immunity?
Between 7 and 8.
And we got $9 million sitting in the bank. We need to be paying folks to get this shot. Unless we just gonna sit up here and let it get worse. And I think that's an allowable expense that I think we need to consider. And some cities and counties are doing that. But now we don't think it's an emergency. We just sit up here and just let it just rock on and just do what it does.
I do think it would encourage vaccination.
But I think we ought to provide a financial incentive for people to take the shot.
I do know that where we've had local facilities that have offered financial incentives, they've had employees who were holdouts who came in and got it. We did not offer financial incentives.
Our board attorney wants to speak to that.
The university has got a system set up now where if you haven't been vaccinated, and I can't remember the number, but let's say for argument's sake, they will put you in a drawing, and you get $1,000 out of that drawing, and it's been an incentive for a lot of these students. My daughter came in talking about it this weekend, so it is an allowed expense. I certainly don't know how effective it will be, and I'm certainly not trying to convince anybody of it. I just know that that's what they've done.
Did you say on Friday from 8 to 12 it's free shot?
It is. All our shots are free, though. we don't charge for
You
vaccinations.
know, I think all the pharmacies are too. I mean, you can go in pretty much anywhere and get it right now if you wanted to.
I don't know that pharmacies are fully free. They may have modified to be free now. They were not originally. They charge an administrative fee.
Just for the public, tell where on Friday where.
Yeah. It's in the community room at the hospital. So if you come in the main entrance under the awning at the hospital, you'll go right past the security desk and take a left. And typically there's a line. We typically have someone there to control traffic and everything. So they'll be able to direct you.
I'm of mixed feelings about Orlando's suggestion. To me, I just think that if the science has been proven, the data is there, and if people still don't want to get that shot, I mean, I think I'm not going to say irresponsible, but it's their choice. But I think all indications show that if you get the shot, that you are helping yourself and people around you and your family and all. And I just don't know if an incentive will get us to that 78% herd immunity. I've seen $1 million being given, and they said it didn't really increase the.
Well, for the ones I've seen, they have, and that's why we got the money to battle COVID. So we don't need to get. And I'm the main one. I got other things I want to spend it on, but that's why we got the money for COVID. So we need to have a full court press on using that money to help eradicate COVID in this county. And if we don't, it'll be on us. It's not going to be on anybody else. It'll be on us because we got the resources to try to make a difference. And if we're not going to do anything,
you can't just put that whole blame on the board. You got to put it on individuals.
No. But I'm talking about the money that we got from the federal government is for COVID. That's what it's for. It's for COVID-related issues and expenses, and we need to be more aggressive trying to utilize the code.
You could do a little sampling and see, but I just think it goes back to that individual who's just.
What you were talking about, Attorney Robertson, $1,000, is that per semester, is that per month, or what?
I think what they were doing is I'm not sure, but I will say it was every month they were doing a
$1,000 raffle.
It's a raffle, so to speak. And I certainly I have not looked at any data that suggests it works or doesn't work or anything like that. But it is available. That is an idea that's out there, and it may be something worthwhile to flush out and see if it will work.
But there's actually people, I think, in the community now that are going around. It's a public thing. They're going around encouraging people to do that. I mean, in a lot of communities, they're going to look at it. There's already a campaign out there for it.
I think we need to come up with some kind of incentive. We haven't, I think just now, I don't know whether we can actually come up with what that incentive would be. Of course, time is important.
When people start dropping that line, that's when
Time is important.
That's
So we need
exactly
to move as quick as we can. But what incentive is going to work? And I had the same question that John had. How often was that $1,000 was given? And then can you break it up instead of giving 1,000? Can you break it up and give $250?
10 people, $100 apiece.
Yeah, and have more people winning and have it being done more often. But they will win less than $1,000, but you find that more people will be winning. So I think we need to come up with some kind of incentive. I don't know whether we can do it today, or maybe we have to go into how would we do it? Go into the radio section or something.
Honestly, I think y'all can do it however y'all want to do it. I think as long as it's within some parameters, but I can find out what those parameters are. I'm not for sure. I'll flush it out and see what you're looking at.
Attorney Robertson, get back in touch with you.
What are the options out there too for just, I know as much as that, it's important to keep your immune system up for vitamins and things like that people, because those are really expensive. And, to keep your immune system up, that's going to help you fight things off. I mean, what are the options? Will you see, if anything, for something like that too? Because a lot of times people aren't going to buy a vitamin because they are expensive. We check on that as well, because I think building your immunity is going to help this as much.
It is a vaccine. Everything helps. My daughter, 2 of the girls that work in the office with her, both of them mid-20s, healthy, no immune problems, no anything. Both of them got COVID. One of them had a fever and was a little sick. The other one was in the hospital. I mean, so you know, it's real. It's just a crapshoot whether or not if you get it, which way you gonna go with it. You know, I want to do everything we can to encourage people, but I don't know if a person doesn't fear it or doesn't think it's gonna happen to them or their family, it's not gonna. I mean, it's not gonna really make a difference. And just the elephant in the room has become so political with the mask wearing and vaccination taking, and it's just.
It's awful.
It is. It really is. I mean, you know, and almost 8,000 people have died in the state of Mississippi from this COVID. Then, you know, people want to kind of say, well, did they have some underlying conditions? Well, if I've got an underlying condition and I'm living and you shoot me and I died because you shot me, not because of my underlying condition. So, you know, it's just.
Well, you can have those same underlying conditions and live until you're 80.
Absolutely.
I think that needs to be.
Since we're talking about spending money, I think we need to hear from our county administrator.
I was going to say, I have no say in any of that. I'm just
not about that part, but you mentioned earlier, I'm back to the testing.
Yes, ma'am.
You mentioned earlier about having the test. The first test positive, you're off, you're quarantined. You're no longer symptoms, well, you show no symptoms, no fever. After 10 days, is it safe to return to work, or do you recommend a second test?
I don't recommend a second test. I think from what I have seen, most people are still going to test positive for up to 3 months.
Gotcha.
It's just the way the test works. It's still going to test that way. It's just not contagious anymore.
Okay, perfect. I asked her that question, Board, because I've been contacted by some department heads who have had workers out and are being required to retest. If they are out for a lengthy amount of time, it can turn into a disability. The first day is personal. After that is medical. So they are still out on medical leave, even though they're no longer contagious. Is that correct?
Yes, ma'am. Their symptoms have dropped and their fever's gone.
It's safe to return to work.
So I think
It's going to have the docs on.
Well, I think that's what I'm thinking the policy should be on your, if you're still ill at the 11th day, you go back and just get a doctor's note that says you're still having a fever or whatever you're having. I mean, because she already said that you may have a cough for months.
Exactly. But if there are no symptoms, then you're saying it's okay to return to work. You all are going to have to put something in place.
But at the same time, if there's no symptoms, I still think that you need to require the mask. I mean, I know you don't want to hear it.
Well, I'm
but
requiring
I know
masks.
some of us sitting up at the table without masks on, but now we're in a leadership position. And if you're gonna let those folks, if they come back, then we need to require masks to be worn, because according to what I can tell, the mask wearing is recommended.
Especially for unvaccinated people.
For unvaccinated people, we ain't got to get into whether they're vaccinated or not.
I think that's a difficult.
Now, you're not talking about a countywide, right?
I'm talking about county what? I'm talking about here right up here, this board meeting right here now.
The thing about it, everyone can catch COVID, whether you're vaccinated or not. And you can pass it on whether you're vaccinated or not.
You can. It's less likely, but you can. But in both cases.
It's not as easy, but it can be done.
So, I got a question.
Yes, sir.
You had COVID last year. What is your medical opinion on having the shot? If you had COVID?
I would absolutely say do it. I will tell you, I've seen very few people who've had COVID and the vaccine get COVID again this way. I think I've heard anecdotally of a couple, but I've not seen any that have had COVID and the vaccine tested positive. Now, I'm not saying it doesn't happen, but it's much less likely. If you have 2 kinds of antibodies or one, I've had COVID and the vaccine.
When you see on TV, they say, you know, if you had COVID, it's better than having the vaccine.
In the past, we would have said that, but I think of it like the flu. So every year, the flu changes just a bit, right? And we try to make our best scientific guess as to what the strain will be. And the vaccine every year fights that strain. Well, these variants we're talking about, it's similar to a new strain of flu. It's a new strain of COVID that comes through. And you may have antibodies to the old strain. That doesn't necessarily mean it will keep you from getting it. I have had employees at the hospital who've had COVID before who have tested positive again and had to be home twice. So, what I will say for me, and I think Dr. Landrum gives a really good example of this, you know, where you say, I've got all these different barriers, you know, and each one of them has some holes in it. It's not perfect, right? None of them are perfect. But if we're shooting from here to here, and you've got all those barriers in place, it does make it less likely to get to the end. So that's the plus.
I guess, but I think our administrator is asking us to come up with a uniform policy that will transition from department to department. Because if the CDC guideline says come back after 10 days if you're asymptomatic, and a department says, well, I want you back after you've taken got a negative COVID test, we're gonna have to get something uniform here, so that each department head doesn't have their own rules and there's a lot of confusion. We either go with what CDC guidelines says after 10 days asymptomatic, or we set a policy that says what it says, and that's what everybody go by.
Would you recommend a 10 or 14 days?
As I was going to say, so what the hospital has done, if this helps at all, so we say, okay, day 11 you can return. If you still have symptoms on day 11, what HR and I worked out was, okay, day 11 through day 14, if you still feel like you are too sick to return, we will allow that under the guidance of employee health and that kind of thing. But if you're telling me I still feel awful, we're not making them go back to the doctor at that point. Now, if they hit day 14 and they say, I am still sick, at that point we are. Because we are seeing occasionally people that just have, you know, that little gap seems to help. So, but that's, of course, up to y'all how you want to do it. But we allow return on 11. We'll let them go to day 14 if necessary, and then if they can't, we then make them go to the doctor. The other thing for us, and I don't know if this would help you or not, we run into the issue of, okay, what if they test over the weekend? What if they test on so-and-so day? So we, the rule we set was, you know, the first day of leave used or the day after test. So we don't count day of test because for some people that's 11:30 at night, and you're going to run into different people saying, well, that's not day, you know. So we say day of test if leave was used that day, otherwise we go day after for our 10-day count.
So,
if that helps.
so after day 14, because you know you're gonna have some people, I'm just not feeling good, they don't want to come to work. After day 14, if they call in and still not feeling said they're not feeling well, then do we require them to go to the doctor then to get it?
On day 15?
On day 15. So this don't go on 21 days and people are still not feeling well and I can't come to work, and it's starting then to, you know, if you're legitimately sick, that, but, you know, I'm just trying to think of something.
And like she's saying, a positive test won't give you clearance. I mean, you're going to go test positively.
Yeah.
After months.
And not everyone does, because that's not 100%, but it does happen.
I just think we've got to do a policy. We've got to get something in place that's.
You want to say 14 days then, just to be safe?
Yeah. I would say return date 11 if you
With no symptoms, and then.
But if you call in for up to 14 days and you're still saying you're sick, day 15 you will be required for the doctor's excuse, sort of like what we do now. You know, after you go so many days on out, you got to have a doctor's excuse to return to work. But I think with COVID, we go day 15. I'm just, you know, we got some more board members now. I'm just, and also you can help craft this policy that we're talking.
Are you going to require the test, the second test? Yes or no? Because it could come back positive. You're gonna extend it.
Well, she said you can test positive up to 3 months, so.
That's the holdup right there, requiring them to take that test. Are you gonna require them to
I would
take
say
it?
asymptomatic.
Only if they're showing symptoms. If they're not showing symptoms, no test.
I would say if you're not showing symptoms, you can return.
I was just gonna say that whole testing thing coming back was something that people did in the very beginning. We even kind of did that in the very beginning until we found out that you know, people were gonna test positive for up to 3 months or after. And then we changed our policy, so I kind of feel like maybe that's an old policy.
Okay.
And maybe shouldn't, you know, could come out of it.
A lot of groups have that initial knee-jerk 14 days have to retest, but it
Right.
changed relatively quickly after that, but very few companies changed their protocols. Hospitals did.
I mean, you're still learning about this thing, and I think the two things that's been proven is masks and vaccines definitely help, you know.
11 days with no symptoms, but still required to wear a mask. Now, wearing a mask thing to keep you from, not you from getting infected, but keep you from infecting someone else.
So the Supreme Court's just ruled, like in Texas and some other places, that you can't do mask mandates. So, I mean that just came out on the news.
Based upon,
With the lower courts, I mean, it's on there that the Texas Supreme Court.
Yeah, I think some governors tried to sue school boards and stuff, but they lost. That school boards are still able to do mask mandates.
They're not supposed to. That's the whole thing on it.
but this issue here shouldn't divide it. This shouldn't divide it, and I know what y'all.
But I'm just, there's a lot of people that don't believe that they should
But
be
what do we
mandated.
do? But I'm saying, what's the alternative? We wanna
People need to
deal
take
with this.
responsibility for
But
themselves.
how can we make people take responsibility without passing some type of mandate or what? I mean, how can we do? I wish people would, but I'm just saying we're leaders, and so we gotta look at it from a different perspective.
You know, listen, you all been around people. Honestly, you don't know whether you have it or not. You don't know whether you're passing it to the next person. I'm not saying you would do it intentionally. I'm just talking about the unintentional passing of it. But I don't know, President Williams, can we legally mandate somebody that's had COVID if you return to wear a mask without doing an entire mask mandate? I'm just, attorney.
I think Mississippi State did it best. Look, vaccinated, not vaccinated, whatever. Because for a while, that's what people were getting targeted. And I think Mississippi State did the best. If we're going to make people wear masks, everybody was good.
But if you're in your private office by yourself, you do not have to wear the mask.
I don't have heartburn over that. People say put a mask on. It doesn't bother me. I mean, I don't fully agree with the mask helping. Okay?
And I agree with that. In my office, whenever someone walks in with a mask, because in my office, we don't typically have a mask on because we're with each other all day. They have been forever. But if somebody walks in with a mask, the deal is we either put on a mask or ask them if you'd like for us to put on a mask, and we do it. I think that in this situation, though, whatever we do, it needs to be uniform.
Because people were getting singled out.
Correct. I think that to me, the problem starts entering in is if we are distinguishing whether or not you've been vaccinated or not vaccinated, or if you had COVID or if you haven't had COVID. If whatever we do, I can defend as long as we do it carte blanche.
I would say day 11, you can return to work if you're asymptomatic. If you call in up to 14 days and say, I'm still not feeling well, then a doctor's excuse is required on the 15th day. But on day 11, if you return asymptomatic, I don't see where making them wear a mask. Now you can, remember when we did the mask, we left it up to the department heads as far as having their offices require whether or not you wear a mask. But
I think if we're going to do masks,
we should do that.
do it all.
I think we should let the department heads decide, just like I think we should let personal businesses decide, but that's my opinion. In the county, I think if there's a business and it has a sign up that says we require a mask, I put a mask on. But for those that do not require a mask, if I don't want to put a mask on, then I go in there. I think we should leave that up to the department heads and to the businesses that in the county. That's my.
So as far as being off, up to 14 days, that 15 day you need a doctor
You need a
excuse,
doctor.
but not required to retest, just have a doctor's excuse.
Right,
That's
because
correct.
you need to go to the
Okay.
doctor, let the doctor make sure that you
still
okay then.
got a fever, whatever,
Yeah.
but
yeah.
not requiring a test,
Right,
but a
right,
doctor's
right.
excuse.
A negative test. Because the doctor's gonna test you anyway, so you'll know, if you have to go to the doctor for COVID symptoms, you'll get a test. I mean, they'll test you. So that's sort of built in. But I think the 10-day deal, the 11th day deal is where if you can return to work on the 11th day if you're asymptomatic, you know,
It's still not-
because it's been stated that you can still test positive for three months. So that doesn't really, tell you.
So the testing is out.
We need to
I
do it.
think so.
Okay.
We need to do
Alright.
a board order on that as well.
You do, I just need
I'll make that motion.
some guidance so I can inform all the department heads as to this is what the board has adopted. So everyone is on the same page.
But the mask mandate per department is still in effect,
Yes,
depending on
that's
the
up to the
department.
department. I am requiring masks in county administration.
Okay.
Just so you know.
That's fine.
You'll find that the hospital requires the CDC and OSHA mandates us to in healthcare facilities. We have to.
Supervisor Montgomery.
Second.
Second by Supervisor Powell to establish a policy. Are there additional questions? No questions, all in favor? Motion carries 5-0.
Can I make one request? If y'all do decide to do an incentive program for vaccinations, keep in mind that a couple of the vaccines are not complete unless you get a second shot. And however you set your parameters, we would want to be cautious that people don't come in for extra vaccines that they're not, that they don't need, however y'all decide to do that. But we have no problem getting you information if the people are okay with that. So. All right. Thank you.
Thank you.
Thank you.
We move forward. Washington Power, Campanella.
Good morning.
Good morning.
Watson
Did y'all
now.
get the, you still have the, did y'all get the,
Campanella on her.
did y'all get the email I sent y'all with a copy of the tower commission? So Forestry owns the tower now. We have, radio equipment on there. Currently, Mayland has a site on there and OCH has a site on there. So what is Forestry wants to sign that over to us. So it's an acre of land and the tower.
Is that the one back up
It's
on
all
Sturgis?
Mayland starts
Sturgis
on,
Road?
Hawkins.
Yeah, okay. Yeah, the 5 tower one did, yeah.
Yeah. And so it does need a little bit of work to it. I talked to Wayne, which is also the fire chief at Nathan, and he works for the county. But he said the county would buy the materials and he'll fix it. It's the steps and the floor of the thing needs to be replaced, but of the building. But they just want to sign it over to the county.
They won't sign any other ones over, just this.
I asked about one on 12, so I'd like to hear back on that. Because we could have a possibility to add a Midland site to that. We're trying to see if it's tall enough. I'm not sure. I think it's a little over 100 feet. But the elevation of the land, it may make it tall enough where we could have a Midland site that would help cover maybe if we decide to go this way.
So we get the tower and some extra land, I see.
Right.
So we can house, say, a tractor.
Yeah. And I would suggest putting it on insurance. Sometimes you do have lightning strikes and that sort of thing, so that way it would cover, or somebody's out there, there's that liability if somebody's out there and falls or whatever, but, having that insurance.
I'll make that motion.
Yeah.
Motion by Supervisor McCombs, second by Supervisor Howard, force retirement transfer. All in favor? Motion carries 5-0.
Rob, do you want to get with that attorney to get all that?
You and I'll talk about it.
Okay.
We'll
I
talk.
sent in that email, I put their attorney's name
Okay.
that should do all that paperwork and transfer it over. And I also have one more thing. So the Maven Tower, the ham radio guys, they already have equipment on the Maven site. They're wanting to add some additional equipment. So that's fine for y'all. It would take up a little bit more power, but you probably won't see a difference. But they just want to get approval to add that
We
extra
need a board
equipment.
order for that.
I guess, just so we're covered.
Make a motion to
Motion
allow
by-
ham radio.
Yeah, amateur radio, they already have a little bit of work, but they want to do some changes. add some more
additional equipment.
equipment on there.
Motion by Supervisor Montgomery, second by Supervisor Miller. All in favor? Motion carries.
Are you gonna contact them on Highway 12?
Yeah, they're checking on it to see, because they don't do anything with that right now.
Did they ask you at all to get a Sturgis for the bike ride coming up this week? I mean, I didn't know if they.
No, they haven't. Last time I think the Night Valley, they had the radios, we took some radios down
No
there.
one climbs that tower on Highway 12 as far as you know, do you? I mean, never mind.
Me. I've seen people climbing up it on a Sunday, and I'm like, well, that's what you want to do.
When I was 18, 19 years old, that was a thing. I would never go every time. Oh my goodness.
Thank you, Mr. Watson. Move forward. Tax collection contract. Mr. Allen. Mr. Allen.
Do we need to do an executive session?
This is a personnel issue, so this would probably be preferable to have conversations so that everybody can.
We need to go to closed session first.
Closed session to have, determine whether or not we need to wait. I'll make the motion.
Motion by Supervisor Montgomery, second by Supervisor Howard, that we go to closed session. Determine executive session. All in favor? All in favor? Motion carries 5-0.
You short, wait.
Seatbelt grant. Welcome. Word.
We applied for seatbelt grant in the amount of $15,000 and DUI grant in the amount of $10,000. We were approved on both. This is going to be for a 100% reimbursable overtime grant in those two areas, if y'all approve.
Thank you. Motion by Supervisor Trainer, second by Supervisor Miller.
Thank you.
To approve the acceptance, basically, of the seatbelt grant. All in favor? Motion carries 5-0. That's good, 100% grant.
Yes, sir.
Chancellor business. Livingston.
I have two things real quick. The first, I need a board order to close out the real and personal property assessment rolls. I had nobody come in and disagree with the amounts.
Motion by Supervisor Miller, second by Supervisor Howard. All in favor? Motion carries.
And the second thing, I need a board order to acknowledge that I had an affidavit of publication to come back on the bids for the soil and cement.
Motion by Supervisor Miller, second by Supervisor Trainer. All in favor? Motion carries 5-0.
That's all I have.
And they're going to bid when?
They've already been out to bid. This is just my publication
The bid
that I
opening
received
is the
showing that
23rd
it
at 10. What? The bid opening is the 23rd
What was
at
the
10.
motion? That second one?
Or cement.
affidavit of publication of the soil
Telephone.
cement. I just have to have a board order when we receive these.
Open bids on 27th.
It's 23rd.
23rd.
The soil cement bid opening is the 23rd at 10.
Where that X is right here. And that's all I have.
Move forward. Business administration.
You have the payroll changes in your packages for approval. In addition, I also put a sheet on the table, just a recommendation. That's the maintenance department. I am hoping the board will support me in what I wrote down to go in effect October 1. The very last name on that list, that's the individual that went to another department. It did not work out the way he was told. He came into my office Friday and he thanked us for working with the county, but he had to go on because it did not work out. So I contacted the head maintenance guy, asked him if he was willing to have this guy come back because he is such an asset to the county. He knows the buildings in and out. And so if the board approves, I would like to bring him back at that rate, and all of it will go in effect October 1. So now we'll have two people in maintenance. We now only have one. that take care of the entire county. So if that's okay, I will bring that back later, but I just wanted to, I don't wanna lose this guy. He's a value to the county. So I have the payroll changes in your packages. He's not written up in that because I wanted to present it like that first. I don't know who oversees this department. Is it you all? Is it administration? Because they've been neglected.
Administration.
We gave that department some increases not too long ago, didn't we, last year?
No.
Not more than
No.
3%.
Not those.
I thought we did when the lady came to us, remember, that was cleaning the restrooms, and then she ended up leaving, and we gave both of them increases.
That was her and one of the gentlemen
The
on
top
that.
one, yeah.
If you look at that,
No,
he
sir.
has been here since 2008.
The
And
second
look
one.
at what his pay is.
You're talking about Bobby.
Yeah, I don't want to call names.
He works hard too.
He works
Good
very
work.
hard.
Good work.
I'm fine with top stuff, that bottom one, I'm a no on that. Personally.
Well, I just make a motion to approve payroll changes.
Payroll changes in the pipe?
Those, the payroll
I'll
changes.
say.
Yeah. Motion by Supervisor Trainer, second by Supervisor Montgomery, that we approve the payroll changes that's in the package. Any questions? All in favor?
Are we advertising for these
Motion carries
positions
5-0.
too? Are we advertising for
I
these?
advertised for the one I had them all. One I did. One I promoted from within.
I've got a question.
Yes, sir. Yes, sir.
Administrator,
Yes.
are you requesting these to go in effect and then give them
No,
the 3%?
not the
Okay.
3%. No, not the 3%. Just what I.
Just this?
Just what
and
I
not
wrote.
give them 3%?
Not give 3%. Let's just bump them up to that.
Okay, got it. I understand.
The other ones don't know I did this, but that last one, I just need some, he's gonna leave. He's gonna leave regardless. And I would like for him to stay.
I can say this, out there on the road, that farm is crushed that this guy's leaving.
Yes.
He said he's absolute go-getter, know how to operate all
Yes.
the equipment and everything.
It's a shame he's leaving that department
Yeah,
because he's better fit there. But he's a hard worker.
What?
When he was hired, he put him on a 90-day probation period. Told him after 90 days, and wanted for him to do everything he could to try to keep him. Yes, he hates so bad to lose him, he don't know what to do. He's mad at this guy's a go-getter.
Nothing on this one.
Okay. We're gonna come back to payroll changes.
Okay, that's late.
I mean, if it's okay, I can write him up later and have him sign it.
Lord,
Just say it's
he was already with
I
the
can write him
county
up and
in
sign
maintenance
it.
with that. Now he's
Yeah,
going back.
that's what.
She's requesting to bring him back into
For
maintenance.
this one, I don't want to leave.
We need him, out on the road.
I agree with you, we do need him.
That's exactly what we need, him.
But he's a hard worker, so if this is okay, I can,
I think they need to be officially written up on paper, not just.
Oh, I don't have a problem doing that. But I just need to know on that last one, is it gonna be okay? And I can bring him on back and let him know what can happen October 1. Just give me some guidance.
That'll be up to him. I mean, we approve.
I talked to him, I asked him, I didn't tell him this part, I said, just give me time to think. And I'm gonna call him this afternoon, so if you're saying to me, yes, we'll do that October 1, I'll tell him, okay, come on back to us. October 1, this work.
I would like for this board to consider
Okay.
moving him on to the 20 and keeping him out there on the road department. That's what I would prefer this board to. And as much as we holler and squeal about not being able to keep up with the work that needs to be done out there, and you got a guy that can do it. I mean, to me, it would be a waste to bring him back into maintenance
I understand.
when he's such a benefit. That's just mine.
You know, he goes. I don't know if he'll go back. I mean, I don't know if he'll go back to that
Okay, I'll write those
Okay.
up and we'll
Just
just
see.
see how that goes. Cloud also sent to me MSU facility management permit. What they're wanting to do is to construct driveways that will connect to, our Tuhaw County Road. And I put a copy of that in your packet. Yes, that one.
I move with
Yeah, second that approval.
There's no cost to the county, so they know that. All in,
He motioned, I'll
by
second.
Supervisor Howard, second by Supervisor Montgomery. All in favor?
We have an invoice from Pritchard Engineering for, this is for on the courthouse road for $52,011.97.
So y'all read my email on that? So I think we should go ahead and possibly let him collect it the other way and bid it out. But Attorney Roberts, can you make sure that his contract says the standard 12% and that you get the days on it? Because I don't want us to, what happened before on Blackjack when we delayed and on Longview, we ended up not collecting the county funds from it. So he's supposed to submit this, not of our funds. So I would say, let's go ahead, and that way we'll know what the cost is gonna be anyway. We don't have to accept the bids, if that's okay with everybody.
So we need to,
So he needs to submit this through state aid dollars pays for this, because this is a state aid project. If we pay for it out of county funds, that's what I was saying in the email, then we can't collect those county funds back. He should deduct that off the bill, but that didn't happen on Blackjack or Longview.
and I don't mind doing it that, but when I make a decision like this, I would like to have Clyde sitting here.
All
Not
he's
just-
wanting us to do is pay for the engineering fees. We were wanting to wait
I know
because
you,
of inflation.
you want to wait, but
No, I'm not.
mean,
I'm saying put it out for bid and let him collect it the normal way through state aid.
not the way we normally been doing things.
That's the way we're supposed to. That's the way we normally do it.
I-
Did you read the
okay,
email?
I'm going.
Did you read the
I'm
email?
gonna be I'd rather have Clyde here before making these decisions. You get the majority approval, that's it.
Once it go out for bid, then state aid will.
And state aid pays it. So my thing is not to pay it right now, let it go out for bid, and then state aid will pay the invoice.
This the one Clyde has been asking if you ready to bid,
Yes.
and you haven't given him permission to bid?
Right.
We have not bid it yet, because we were waiting for inflation to come down.
Well, see,
That's what
that's what I think.
What, this-
I mean, if the guy had did his part, he was ready, and he was waiting, we would have hold up. It wasn't him.
He's getting paid anyway right now. I make a
I-
motion, we put it out for bid and let state aid pay the engineering fees.
I'll second that.
Motion by Supervisor Miller, second by Supervisor Montgomery, to put the courthouse road project out for bid. State aid pay for it. Any questions? All in favor? All opposed? Motion carries 4-1.
So you're not saying you're ready to bid? Or is that what this is?
4-1, yes, and and then state aid will pay, he will collect his fees from the state aid, not from the county,
So let him know to go ahead and bid.
yes.
Okay, all right.
But we don't pay
We're
the,
not paying that. I got you.
I mean, we are, but it will come to
It comes
different
from them.
business.
Okay, that's
Too much
perfect.
money comes from the county. Okay.
All right, we have Pick and B.O.S rental agreement. This is for the Justice Court. Their contract is out and they'll actually get an updated machine this time. I need
It's
a
actually a savings. I make a motion to approve.
Motion by Supervisor Montgomery, second by Supervisor Miller. Any questions? All in favor? Motion carries.
And there's a computer system support, agreement. This is for the tax office, chancery, justice, and circuit. You do all of it in one.
Motion by Supervisor Montgomery, second by Supervisor Trainer. Any questions? All in favor? Motion carries 5-0.
Have a budget amendment for the DUI grant in the amount of $713.
I move with.
Motion by Supervisor Howard, second by Supervisor Montgomery. You accept. All in favor? Motion carries 4-0.
Have a quick claim deed, and special warranty deed. This is from the school, signing it over to Wildlife Dominion for the, Moore High School property.
So moved.
Motion by Supervisor Montgomery, second by Supervisor Howard. That will lead to the quick claim deed. Are there any questions? No question, all in favor? Motion carries 5-0.
Have a couple other things. We need to acknowledge the Starkville October Hall Consolidated School Combined Budget for fiscal year ending June 30th, 2022.
I make a motion to acknowledge them.
Did you send us copies?
Probably came in after y'all started picking it up. You don't have to do it now, but we gotta acknowledge it. Yeah, we're not changing anything on it.
Not to acknowledge. Motion by who? Supervisor Montgomery?
Yeah.
Second by Supervisor Howard. Any questions? All in favor? All in favor? Motion carries 5-0.
Mary Ann also called me from Solid Waste. Wayne Tubbs that own Montgomery Quarters, he's wanting to have them pick up their 3 times instead of 2. The fee will go from $4.90 to $6.20. Well, I called Jennifer, and he's paying over $900 a month anyway. So he's paying more than what he's gonna be charged. So I just need you all to say, yes, we can pick it up 3 times versus 2. Right now, we're only picking up twice.
So can we pick it up 3 times and then adjust it to the proper price?
Well, the price is still less than what he's paying. He's paying over $900 now for all his units. It's only gonna go up to $620.
So, is it costing $900 to pick it up now?
No, it's costing $4.90 to pick it up twice. If we pick it up 3 times, it's gonna go up to $620.
So why is he paying $900?
Because it's per unit. He's paying the $13 per unit,
Yeah.
but he has a dumpster. So that's the price for the dumpster, but he's paying more because he's paying
See, the
based on
Macy's do the same
units.
You
thing.
get a dumpster in.
They just have dumpsters, they don't have garbage cans,
But
but
you
they're
still-
paying $13 for each one of those
Right.
houses out there.
And
And the dumpster.
the dumpster.
He's paying us more money than what he's gonna be charged. Even if we pick it up 3 times, he's still paying more than what he's gonna be
So are
charged.
we overcharging him right now?
No, we're charging him correct.
$13 per unit.
We're charging him correct because he's paying per unit.
So we gonna deduct what we gonna cut?
No, we're not cutting anything. We're just
Pick it up
gonna
one time.
pick up 3 times.
Yes, if they want to pick it up 5 times, I'm fine with that.
Is this the same people that contacted me about the units that, you and I need to talk about, I need to figure
You're
something
talking
out
about
already.
university.
I am.
You're talking about- I know. So I just need the okay to tell Mary Ann, yes, they can do 3 times.
Let's do 3 times. Good, but I mean, we should
There's no
reduce it
cost.
to
There's no
620.
additional cost.
The cost is gonna go up, but he's still paying less than what the cost is gonna go to.
I guess my question is the cost to the company?
It's gonna have to go.
I mean, fuel, manpower?
It's gonna go up. It's
increase
gonna
their
go up.
cost to have to pick it up extra time.
Yeah, it's going up from $4.90 to $6.20.
But he's
Paying more than $6.20 anyway.
I know, but Mary Ann is saying they need they need $620 now to pick it up 3 times.
Yes, but he's already paying $900 and something.
That's what I mean. If he's already paying more than he's supposed to have to pay anyway.
Still paying more.
Can y'all please ask them not to crush any more garbage cans since we're out? Please don't crush any more garbage cans.
They crushed 2.
So can I tell Mary Ann 3 times? or
Yes.
what?
Yes.
Okay, we'll do it. One other thing, they talked,
We need a motion.
Get a motion.
We need a board
Motion
motion.
by,
She made a motion, I'll second that.
motion by Supervisor Miller, second by Supervisor Montgomery. All in favor? All opposed? All opposed?
I'm gonna abstain from that
Okay.
because I'm not fully understanding.
Because
I
We got 4 in favor, 1 abstaining. Supervisor Howard.
Supervisor Miller forwarded an email to me. They're wanting to use the back parking lot for Bulldog Bash, which is gonna be September 17th. She asked me to contact the department heads, which was transfer clerk and tax office. I spoke with both of them. They are not for it. The hours they were wanting would be that Friday from 1 to 6. It interfered with parking, workers, and customers coming into the building. So we need to let them know, yea or nay. Can they use the parking lot?
Bulldog Bash for just people to park?
They wanted, what I was told they want to do is block this off, and they will have the porta johns on this side and have security out there.
Is that on what day?
Friday, September 17th, from 1 to 6.
And I have court time that week, so that's why I said that.
I mean,
So the answer is no to
I mean, it's during.
Yeah, just write, explain to them that we have court that week.
Anytime after 5,
I'm
that'd be
just
all
gonna tell them
right.
no. I just need to know what y'all want me to tell them.
Goes okay.
They've asked before and we've always denied because we had things going on, but they ask again.
How about
So I forwarded it to
tell them they can
everybody.
after 5, you know what I mean, but I don't think they're gonna want from 5 to 6.
Yeah.
I'm sorry.
Okay, and the last thing
Do we
is,
need a motion to that effect?
Just take that, no. We'd have to grant that request.
the last thing, reminder, the budget workshop is this Wednesday, the 18th at 8 o'clock. That's it, that's all.
Well, I just have a few things, coming from, here. MAS Fall Educational Workshop. Pacific Association of Supervisors Fall Educational Workshop, October the 19th through the 12th, to the 21st, in Oxford, Mississippi. They will need to request some travel for that.
So,
Second.
Motion by Supervisor Trainer, second by Supervisor Montgomery. Any questions? All in favor? Motion carries, 5-0. The Mississippi Association of Supervisors Minority Caucus Fall Educational Workshop in Jackson, Mississippi from September the 27th to the 28th. Travel if we haven't already. No, we haven't.
so moved.
Motion by Supervisor Trainer, second by Supervisor Howard. Any questions? All in favor? Motion carries 5-0. Now, I don't know, I get some correspondence that I don't know look like come directly to me and don't go necessarily to county administration. But I received something about county compliance and reporting requirements for the American Rescue Fund. That however we haven't spent any of those dollars, we still have to do a report.
Oh, I got that.
You got that?
That's the August 30th to submit that.
August 30th, August 31st.
Yeah,
Submit,
I
okay.
received that.
Got that. Okay. I don't have anything else, any other board members, supervisors.
Can I ask this on the link appointments, and the partnership appointments, are those rotated like they have been before? And do we have to do that this week? Can we gather some people that want to be on there, who was on it before?
I'll admit I dropped the
That link, I think,
ball.
take
You brought it
that.
up last meeting, but I didn't. I dropped the ball.
Who was on the link board for us? Who was our appointee? And did they attend?
Michael Taylor.
Selma Talley, Joseph Lanfair, those names from me.
Yeah,
Michael
Landfair.
Taylor was
He had
the one that's just going off now.
Landfair's going on.
No, not Landfair.
He's the
They went off a long time ago.
Yeah.
But it's Michael Taylor that's on it now. That's either up, reappointment, or someone else to be appointed. I don't have anyone said this list.
I'm gonna meet with Tommy Tomlinson, but I forgot to give him church.
Can we hold on those two and put some names together in an email and
They
send them?
have to receive it by September 30th. So,
No, that's our next meeting. Will you, tell us who was coming off in an email?
Zelma Taylor, and Michael Taylor.
Is that, who's the link and who's the partnership?
Lincoln.
The partnership is different.
So we had already removed them
The link,
Okay.
also.
I was looking at the chart that was left in the system. It had Zelma, so I really don't know.
I forgot who we replaced her with, but she.
Which time?
I will tell you on the hospital, I'm gonna put my appointee back on for my district, but the at-large that is our turn for Supervisor Howard and myself, I've asked somebody and I'm waiting to hear back, so I'll be able to tell y'all that next meeting. And let me ask you this, can a supervisor put themselves on the board? No? I just wondered, okay.
And I would ask for you to consider keeping me, Dr. Rodman asked Supervisor Howard the same thing, he said he would consider that, so I'm asking you the same thing.
I would consider, I've asked somebody else and I'm waiting to hear back from them, but I will consider that. But I am gonna put Mr. Amos back in his position, for mine, but that, as far as, that wouldn't be the at-large, that would be the normal.
October 1st.
had a resolution, approval for George Curry.
So moved.
Motion by Supervisor Trainer on the resolution, second by Supervisor Montgomery. All in favor? Motion carried 5. Motion carried 5. All in favor? Motion carried 5.
I think she said she was gonna wait on her possibly appointment.
I'm reappointing Linda Brazil, but on my at-large appointment, I'm gonna hold up for right now. Start considering, Supervisor Trainer's request along with another person that had asked me several years about serving. So I'm gonna hold up on that large right now.
I second the motion to reappoint Ms. Brazil.
Can we add Mr. Amos in too? And Mr. Amos.
Mr. Miller.
Your appointment.
Ms. Brazil and Ms.
That's not my at-large, but that's,
That's
yes.
your appointment. Okay.
Neil Amos.
Neil Amos. And repeat your name again.
Linda
Linda
Brazil.
Brazil.
All in favor of those two appointments? Motion carries 5-0. Yes, we need to do it.
I work in China.
Do we have any additional,
China's
comments coming from the supervisor? We have traveled to the non-college, that's already been covered, so, in addition to.
A resolution declaring the expansion of the East Knox Hall wastewater district. I would like to get approved for, I gotta put a couple of wording in here that needs to, but I want it approved before, since they can go ahead and get it sent in what they need.
So, motion by Supervisor Montgomery, second by Hanson, second by Supervisor Trainer. All in favor? Motion carries 5-0.
Conference, there was 2 days.
We don't have any further business, let's, set the meeting.
Got one thing.
I just motion to go recess until Wednesday at 8 o'clock.
Wednesday at 8 o'clock, motion to
We
recess.
need to try to find something.
No,
All in favor?
just, I gotta just make sure I'm signed up for the
The fall one in October. That's the
one
next.
day.
8 o'clock is 8 o'clock.
That's the one that I'm talking about. Those rooms.
You're talking about rooms, I'm talking
No,
about.
you know, we talked about it.